if you have jaw pain, chronic TMJ, or chronic sinus issues, it may not be a jaw issue. And you've probably been to multiple doctors like many of my patients have. And they ruled out it's not TMJ, there's nothing going on with the joint. You have chronic sinus issues, but they can't find an infection in there. So it could actually be two nerves rather, that are causing a dysregulation in the jaw and sinuses. These two nerves, one is called the vagus nerve and the other one's called the trigeminal nerve. And these two nerves, they balance the sympathetic and parasympathetic nervous systems, which are the fight or flight, the freeze response, or the rest and digest response. So it's very important for us to understand that these nerves play a critical role in how the jaw functions and how the sinus functions. So if you're sick and tired of having chronic pain in your face, and then just listen up, because by the time I'm done with this, I'm going to teach you one simple technique that helps relax not only your neck muscles, but also the jaw muscles. You guys ready? All right, so let's go into a little bit of science here. So the trigeminal nerve is cranial nerve number 5, and the vagus nerve is cranial nerve number 10. These two nerves need to be balanced or regulated. Now, both these nerves innervate a part of the brain. It's called the dura. The dura is almost like a saran wrap that surrounds the brain and nervous system. And this dura protects the brain and nervous system. And these two nerves are the only nerves that actually innervate, which means send a nerve impulse to the saran wrap that surrounds the nervous system called dura. Now, let's start off with the trigeminal nerve. The trigeminal nerve, like I said, is cranial nerve number 5. Its responsibility is for the sympathetic nervous system. So whenever we get into a state of stress or anxiety and we start clenching or grinding, which might be happening to you at night, it could also be because we have a stress response that's happening subconsciously. So when the trigeminal nerve, because it innervates the muscles of the jaw, especially these big muscles in through here, innervates this muscle through here as well, and sensation of the face. This sensation here and also down through here. So when this nerve gets dysregulated, you're going to have symptoms in not only the jaw itself, but also the sinuses. So it causes muscle tension, not just in the face. When this nerve is overactive, it's going to cause muscle tension in the upper traps, the neck, also in the armpits, the psoas, iliacus, and your calves. So this nerve will influence every muscle inside the body. It increases the stress hormones like cortisol, adrenaline, noradrenaline. And these stress hormones will also not allow you to lose weight. So you start holding weight around the midsection because the trigeminal nerve is overactive. And then it causes what's known as a fight, flight, or freeze response. So bear with me for a second. Can you remember a time when somebody might have cut you off, or a friend, or somebody said something or a family member that said something to you that you can think about right now? That's right. So as you're thinking about this right now, you might start noticing the heart rate goes up, the blood pressure goes up. So what's happening right now is we're activating a sympathetic neurological stress response inside your brain and nervous system. And we're the only creature on the planet that can think about an event that happened in the past or think about an event in the future, and we create the same visceral response that you feel now. So in order for us to regulate this, we need to have a balance between the trigeminal nerve and the vagus nerve. So the vagus nerve is cranial nerve number 10. It's responsible for the parasympathetic nervous system. It decreases muscle tone. So whenever we have high stress and we start breathing, it's going to help regulate the balance between the left and right side. So between the trigeminal and the vagus nerve. Now, under a stress response, what happens is our carbon dioxide goes down a little bit. And when carbon dioxide drops, it's going to create hyperventilation to rebalance the body. So when we breathe, deep breaths, slow breaths, even short, slow breaths, we're actually activating the vagus nerve. So breathing is so important. I did a video on box breathing the other day. Just watch that video. So when we're activating the vagus nerve, we're also down-regulating stress hormones like cortisol, adrenaline, and epinephrine. We're also upregulating hormones like oxytocin, which is the feel-good, the loving neurotransmitter and hormone. We're also optimizing a thyroid hormone, which sets the pace or sets the rate of your metabolism. So when we have high trigeminal nerve, we're going to have low vagus nerve. So they work synergistically with each other. When one goes up, the other one goes down. So it's an inverted relationship. And when we're under stress metabolism, we're suppressing anti-stress metabolism, which is the vagus nerve. We're also going to decrease or increase rather when we're tapping into the vagus nerve. We're also going to increase thyroid metabolism, which increases our metabolic rate. All right, so you're going to have more energy, you're going to have less fatigue, you're going to burn more fat. It's also going to lower your heart rate and blood pressure. And the vagus nerve is responsible for the rest, digest, and recovery side of things. All right, so that's an understanding between the sympathetic and the parasympathetic nervous system, the trigeminal nerve, and the vagus nerve. Now I want to teach you one simple technique that you could do on a daily basis. So watch what I do and feel free to follow along at the same time. So if you think about it, anytime we clench our jaw, the muscles of the jaw and the muscles of, this is called the temporalis muscle. So this is the masseter, this is the temporalis. These muscles hold down. So when that happens, typically the head goes forward. It's a reflexive postural adaptation that occurs whenever we bite down on our jaw. So as I do this and I get stressed, my head will go forward. The muscles in through here become very, very tight and restricted, which is going to put a lot of tension into my upper traps. So what I want you to do from here is this. I want you to sit up nice and tall or stand, and I want you to bite down in your tongue. And as you bite down in your tongue, I want you to place your thumb on the underside. This is called the omohyoid muscle. You want to put pressure like that. So you want to push up. Pretty firm, but not to the point where it hurts you. Now, as you're doing that, hold this here, and we're going to take a breath in. I want you to breathe in for 5 seconds. 1, 2, 3, 4, 5. And then I want you to exhale for 5 seconds. 5, 4, 3, 2, 1. Inhale from the nose. 1, 2, 3, 4, 5. Exhale from the nose. 5, 4, 3, 2, 1. Inhale from the nose. 1, 2, 3, 4, 5. Exhale from the nose. 1, 2, 3, 4, 5. Inhale through the nose. 1, 2, 3, 4, 5. Exhale. 5, 4, 3, 2, 1. So we probably did that for about 30 seconds. And you may notice now that you feel a bit different. You feel a bit lighter. What we're doing, we're resetting the jaw position, relaxing the masseter and temporalis at the same time. And we're adding breath control. So we're increasing carbon dioxide in the blood, which releases more oxygen. And then now we have more oxygen circulating in the body. And you might notice that you also feel a bit lighter, or maybe your hands get a little bit tingling. That's a great response. So that's how we down-regulate or turn down the trigeminal nerve. The next step is to up-regulate or turn on the vagus nerve. And this one's really funny, so bear with me. What I want you to do is I want you to swallow. And as you're swallowing, I want you to rub your ears. And the reason why we're swallowing and the reason why we're rubbing our ears at the same time is as we're swallowing, we're activating the vagus nerve, as well as a nerve called glossopharyngeal nerve. As we activate these two nerves, it actually down-regulates or turns down the trigeminal nerve. And the ear is actually innervated by the vagus nerve. So you're going to rub the ear to stimulate the vagus nerve, and you're going to swallow at the same time. Good. Let's have we do that 5 times. And you may notice it gets very difficult to swallow. And a lot of the times, that's because the sympathetic nervous system, the trigeminal nerve, is too overactive. All right, so do that about 5 times. And now the next one's gonna be a little bit easier. So what I want you to do is I want you to rub your tongue to the roof of your mouth. And I want you to hum at the same time. By rubbing the tongue to the roof of the mouth and humming at the same time, now we're activating cranial nerve number 9 and 10, glossopharyngeal nerve, and the vagus nerve. Now we're gonna stack this with rubbing the ears. So you're gonna hum, and you're gonna rub the tongue to the roof of the mouth at the same time. You're doing so good, keep it up. And do that for about 30 to 60 seconds. Now, after you're done with this, you may already notice that you're feeling just different. You're less stressed, you feel less overwhelmed, and maybe you could feel the muscles, and you might notice that you might feel a little bit less tight in those areas, and you just feel overall a better sense of well-being. These 2 or 3, if you combine the humming, so let's review it. So the first one was biting down your tongue and pushing up. And you want to breathe through your nose about 5 to 10 reps. And then you rub your ear and you swallow. That's number 2. And number 3 is rubbing your ears, rubbing the tongue to the roof of the mouth, and hum. If you have a lot of pain, not just in your neck, but other parts of the body, you could do this every hour. Why not? This is called the neurological reset. And the more you do this, the less pain you're gonna have over time. All right, guys, hopefully you enjoyed this. I really appreciate you spending time with me, staying to the end. And I have a lot more videos like this. Feel free to subscribe to our YouTube channel so you get notified every time I put another video out there. And I look forward to helping, serving, and growing your health. Sempre Levante, always forward.